Hey, friendly listener, are you enjoying the Impact Podcast? Then give us a thumbs up and leave a 5-star review on iTunes, Spotify, Google Play, or wherever you listen to your favorite podcasts. This edition of the Impact Podcast is brought to you by ERI. ERI has a mission to protect people, the planet, and your privacy, and is the largest fully integrated IT and electronics asset disposition provider and cybersecurity-focused hardware destruction company in the United States, and maybe even the world. For more information on how ERI can help your business properly dispose of outdated electronic hardware devices, please visit eridirect.com. This edition of the Impact Podcast is brought to you by Engage. Engage is a digital booking platform revolutionizing the talent booking industry. With thousands of athletes, celebrities, entrepreneurs, and business leaders, Engage is the go-to spot for booking talent for speeches, custom experiences, live streams, and much more. For more information on Engage or to book talent today, visit letsengage.com. Welcome to another edition of the Impact Podcast. This is a very special edition because I have not only Dallas Kingsbury, who's an MD with us, Dr. Dallas Kingsbury with us today, but he's also a very good friend. Welcome to the Impact Podcast, Dallas.
Thank you, John. Appreciate it.
You know, we're going to get into in another podcast and another date. We're going to talk about some of the things I'm doing with you and also with your wife, Dr. Jane Danford. And, you know, you've seen me and you've been my doctor, I think, going back now 7 or 8 years.
Yeah.
I'm a huge fan of your work. So I just wanted to get that out there for our listeners before to know that we're already associated and we already get to work together. But this is very important of what you're doing and why you're doing it. And we're going to get into that in a little bit. But before we get there, Dallas, go into a little bit of the background of the Dallas Kingsbury story. Where did you even grow up and what inspired you to become a doctor to start with?
Yeah, thank you, John. So I grew up in New Jersey, and my first exposure to caring for patients was actually working with my dad very early on. My dad's a chiropractor, and I was always very interested in health and wellness. And I went to Johns Hopkins University in college thinking I was going to do some kind of neuroscience research or some kind of research involving actually maybe either meditation or the effects of holistic medicine on health outcomes. And Johns Hopkins was not doing anything like that at the time that I was there. And now that actually a lot of big universities are doing that kind of research, but not at that time. And I actually asked a few friends and family, some thoughts, because I didn't want to go into become a neuroscience PhD. It was I didn't love writing research papers as a full-time job, and so they said, well, do you have the credits? Can you go to medical school? And I said, yeah, I think I could probably do that. And from there, I took a few extra, courses, and the next year applied and went to medical school. And the funny thing about medical school is that most of my colleagues, I don't know if I know you know many doctors, John, but a lot of medical students come in knowing, either their family members were doctors or they were heavily inspired by some, physician interaction at some point, and they kind of know, oh, I want to be a pediatrician. I want to be an oncology surgeon. I had none of that. So I was doing well in medical school the first 2 years, and I go, I don't really know what I want to do. Everyone's going to their third year. It's a big year. You're doing all your clinical rotations. And I'm sitting there saying, I have no idea what kind of a doctor I want to be. So I took a year off. The deans at the medical school, actually, this is Rutgers Medical School in New Jersey. They said, sure, you could take a year off, but please come back, after this year. And I took a year off to do flying trapeze. It's a whole nother story, but I joined the circus. Yeah.
And honestly, I have to tell our listeners, the first time I met you, I came into your office, I was all banged up from a bad slip and fall in Minneapolis or somewhere I'd been traveling, and all black and blue, and you took the utmost care to look after me and get me back on my feet again and tell me that everything's going to be okay. But at the end of that session, I remember so vividly, you started sharing with me the fact that you were a trapeze artist, and you showed me some of the most incredible videos that I have to tell you. And I'm like, this guy is not only beyond impressive as a doctor, which you were and are, but you also were unbelievably, fabulously athletic, and you were doing things on the trapeze that I've rarely ever seen done ever before then or after. So you are a very talented trapeze artist. Let's just say that.
Thanks, John.
Yeah.
Appreciate it.
Yeah.
Well, I took that experience, and I, having done that for a year, and then actually having had friends go off to Cirque du Soleil and perform, I still went back to medical school, and through that time, I continued trapeze training and continued sort of in this acrobatic world and performance world a little bit, dabbling here and there, and I really came to appreciate sports medicine because so many of my friends and performers were getting injured, and they'd say, "Oh, you're in medical school. Can you help out with my shoulder, or my back, or my neck?" And I said, "Wait a minute. I already have a lot of experience seeing musculoskeletal injuries, having been with my dad for years as a chiropractor." I said, I think sports medicine might be the right place for me. And that's what caused me to, or gave me the idea, let me do a sports medicine, fellowship after doing a rehabilitation medicine residency, all in New York City. And I kept doing flying trapeze. And that's what got me on my way to at least, the initial phase of my career.
Got it. And you became a doctor, and you became where I saw you originally was at NYU Langone. So you were a doctor at NYU Langone, where you now still are an assistant professor, but now you're medical director for Danford Works and Fountain Life Naples. And for those who want to find Danford Works, you can go to danfordworks.com or fountainlife.com. Go into that a little bit. How did you evolve from being, what was a traditional but unbelievably talented and huge reputational doctor at NYU Langone to the work you're doing now with Danford Works and Fountain Life?
Sure. So, I can start off with whichever one you want to start off with first.
Here's the book. By the way, for our listeners out there, this book is a fabulous book. It's called Life Force. It's been written by Dr. Peter Diamandis and Robert Harari, and of course Tony Robbins is all over it as well, and he's the chief author of this book with these two great doctors. And at the Naples Center, you are the medical director, so it must be fascinating to be involved with these gentlemen and be doing the work that you're doing as the medical director at Naples. So let's start there, and then we'll work into what you're doing with your brilliant wife, Jane Danford, as well.
Perfect. Well, Fountain Life is a preventative health and longevity company committed to transforming global healthcare from reactive to proactive. So I'll get into what that means in a minute, but it is proactive, data-driven, and the idea is we're trying to treat illnesses earlier than ever before. So there's multiple Fountain Life centers, clinical centers people can come to get diagnostic testing. There's one in Naples, there's one in Westchester, New York, and a new center that has just opened up in Frisco, Texas, and then a fourth center opening up in Lake Nona just at the end of the year. Lake Nona is right outside of Orlando. And Fountain Life so I came to Fountain Life basically after moving to Naples with Jane, with my wife Jane, and it was a perfect fit as soon as I interviewed for the job because of my experience in rehabilitation and sports medicine. A lot of the clients coming to Fountain Life have various musculoskeletal orthopedic related injuries, and they can't essentially fulfill their goals in life with being injured. So that was a perfect fit. And, over the years, I'd really been, it's easy to get caught in a system as a physician, I guess, and as a patient, where you just see so many people with major things missing in their healthcare, and being able to be looking at somebody from a comprehensive perspective all at once was a wonderful opportunity for me to take that on. And so our center does a lot of diagnostic testing and comprehensive, almost like an executive physical. And with all of that data, we were able to come up with an incredible, essentially, plan for people for improving their health and life.
Um, let's talk a little bit about some of the more interesting and cutting edge tests that you have new clients, new patients come in and do. Talk
Sure.
about I think it's called the Grail test that you've told me about, the one for
Sure.
cancer screening. You want to share that with our
Sure.
listeners? Yeah.
Yeah. And I'll give you a little bit of background too, right? And just as to why we pick some of these tests to do.
Yeah.
So, our current healthcare model, it's essentially predicated on sick care, right? Somebody comes in with an active disease, active cancer, requiring acute treatment. So, for example, 70% of people who have a heart attack today never had any symptoms prior to that episode of chest pain. And 70% of people who die from cancer die from a cancer where there's no current screening for. So everyone knows you can get a colonoscopy, you can get prostate cancer screening if you're a male, or breast cancer and cervical cancer screening if you're a woman. But other than that, we're not screening people for liver cancer, gallbladder cancer, pancreatic cancer, ovarian cancer. And if you take all of those cancers combined that 70% of people die from, we're not screening for those.
Mm.
So Fountain Life, one of their missions is to pick a few diagnostic tests that can potentially catch those other find and be able to treat those types of cancer that we don't currently screen for much earlier than would have ever presented to a doctor, right? So as you mentioned, there's an early cancer detection blood test, 2 vials of blood, and it has about a 65% sensitivity for picking up cancers that are undetected by your general screening, and then we follow that up with a full body MRI. That's essentially, the protocols for the MRI are designed to, again, minimize false positives and pick up cancer as well as other things. So it is I'll give you some more statistics.
Yeah.
So we've scanned about 4,000 people so far at Fountain Life, and about 2% of them had some kind of cancer, and 2% of them had a brain aneurysm that they didn't know about.
Wow.
About 14% of them had some type of fatty liver disease or elevated liver iron, again, that people had no ideas about, as well as, and then in terms of our other testing, about 40 to 50% of people had some form of prediabetes. So it's a lot of data that we gather on people. Like you mentioned, cancer was a big one of them, and we've been able to intervene and, well, of course, refer clients to either surgeons or oncologists and intervene much earlier than would have been possible, because these are asymptomatic. Yeah.
When you first told me about this a year ago, I said, and you said it takes about what, 2 weeks to get your results once you take the test?
Yeah, 2 to 4 weeks. Yeah.
Okay. But then I thought about, wow, how scary. But then when you explained it to me, that it's better, John, if we're going to think of cancer as a forest fire, it's better to catch it when there's one tree on fire than when there's 1,000 trees on
Exactly.
fire. So the preventative nature of finding someone there when they're between 0 and 1 on the cancer scale than when they're 4 is massively improves their chances of survival and thrival, right?
Oh, by a huge amount. It's something that the statistics are somewhere around, let's say, if you can catch cancer at stage 1, the 5-year survival is about 90%.
Right.
All coming cancer, right? And so that's extraordinarily good. Whereas if you catch cancer at later stages, stage 3, stage 4, we're talking about like less than a 25% survival rate.
Wow.
And if you just pick lung cancer, we're talking 5% 5-year survival rate. So the being able to pick up early cancer at at stage 1 or stage 2 is, I think, paramount for, again, depending on an individual philosophy. It's a little challenging to get into the concept of, well, how could we possibly do this for everyone, and a full body MRI for everybody, and that's impossible. And I think the difference between precision personalized medicine versus population medicine is a wonderful debate. And I think at some point as a society, we will hopefully get there where everybody has access to some kind of life-changing technology like this. But we're really in the earliest phases of this. So it's really fascinating. But no, I unfortunately, it's a slow process to figure out how to make this accessible to everybody. But at this point, I mean, we've had some amazing success stories on the people that have come through.
Those tests, as you just said, that the full body MRI, the Grail. How about the DEXA? You recently had me take the DEXA. We're not going to go into that today, but I find it's life-changing and fascinating why you had me do the DEXA and already feeling the benefits from it. Share about what you do with the DEXA scan.
Yeah, so DEXA is a bone is traditionally a bone density test, but most modern DEXA scans, DEXA stands for dual X-ray absorptiometry, which is essentially a very low radiation full body X-ray. The radiation's essentially like from flying here to LA, half the distance between from Florida to LA. So it's an incredibly small amount of radiation, but it's a full body X-ray done in a particular way that can, one, tell you your bone density, and two, tell you your body composition, of course, if the scanner is capable of that. And it's incredibly helpful. And this is not new. This is actually not leveraging advanced, artificial intelligence enhanced technology like we do have at Fountain Life, or this is actually a very underutilized piece of tech that's been around for a few decades now. Underutilized, I think. Well, I guess I'd have to probably get the opinion of a lot of other people out there who've been in the fitness and health industry for a long time as to why it's been so underutilized. You get a lot of data out of it, but knowing knowing a few key metrics is helpful. We always think about bone density as being a problem for women who are post-menopause.
Correct.
But knowing that you might be on the lower end of the spectrum for bone density, even for men and for younger women, helps predict how you might carry yourself going into the future. So let me kind of reset the philosophy here. So the average physician, again, who knows, again, lots of, all the good things about going to medical school and residency would say, well, wait a minute. We're only doing a DEXA scan in postmenopausal women because those are the people who are at the highest risk for fracture. And we can't possibly scan everyone, and so why are we scanning, so we probably shouldn't scan men and younger women. Because why? Because essentially because what they do is the World Health Organization has a fracture risk score. And then they say, oh, well, if your fracture risk in 10 years is above some set point, then then on a population level, those are the people we should screen. It's a completely arbitrary set point. It's an arbitrary age and an arbitrary cutoff. Above one, say, oh, well, the fracture risk is above 10%. Oh, well, then you're the people we want to screen. Well, wait a minute. That's a 10-year risk of fracture. But what if I have clients like yourself, right, who say, well, I don't want to live for another 10 years. I want to live, I don't know, for another 50 years. Who knows? So if I can detect early changes in bone density that are, essentially on the lower end, let's say one standard deviation lower than average for your age, that may not mean that you're at a serious risk for fracture. You're probably not. It may not mean that you are, that need to go on a medication. Of course not. But it might mean that we need to reevaluate what kinds of physical exercise you're doing. I get a lot of, runners or swimmers who are incredibly athletic and have no clue that their bone density is on the lower end of normal, maybe one or even two standard deviations off from their normal. They would never know that. The other thing is family history. So people with a family history of osteoporosis may have lower than they would expect low bone density. And again, this wouldn't be to put them on a medication. This wouldn't be to assess their near-term risk for a fracture. We're helping people think 30 to 50 to maybe even longer years down the line.
True. But but also, Dallas, break it down like this. Now that you've made me think about bone density because you had me take a DEXA, what's fascinating is what I heard recently in one of the podcasts I was listening to. It's probably, and by the way, for our listeners out there, not only is this a great book Tony Robbins wrote with these two other great doctors, but on page, of course, I failed to mention the first time on page 262 and 263, Dallas himself is mentioned in this book.
Yeah.
So when I say this, Dallas is one of the great doctors out there, and that we're so lucky to have him today. He's in this great book, and this book I highly recommend to people. Tony Robbins was actually talking about morbidity rates, that if you're in your 60s with a poor bone density and you have an accident and break a hip, the morbidity rate is share with
Yeah. I mean, at one point, at least, when this was being studied a lot, when some of the statistics earlier, I don't know what the updated ones are, but I know the morbidity rate was up to 50%. Sorry, mortality rate was up to 50% of a hip fracture, within a year.
That's what he said, and I almost fell down when I heard that.
Yeah, so good thing your bone density is good.
These huge dangers that associate with being low bone density and having an accident or something happen and having some sort of becoming immobile is not what we want to become in our 60s.
And it's really data to inspire people to change, as opposed to, again, how the World Health Organization would look at it and say, this is data used to predict drug treatment in postmenopausal women. No. I mean, yes, that's helpful, but I also think it's helpful for people who are at lower risk of fracture, but to say, wow, I didn't realize my bone density was that much lower than average. What can I do to become more fit, stronger, and healthier?
Well, the whole paradox also is someone like me, who's just an average person on the street, when you had me take the DEXA, I was doing it in my mind to find out my body fat ratio. I had no bone density on my mind. If there was two words that never crossed my vernacular. Now I'm all bone density. I mean, everything's about bone density now. So
body composition is and body composition, as you mentioned, is also very helpful. Again, because the amount of adipose tissue that's around the internal organs, we call that visceral adipose tissue, plays very, very strongly into the risk of cardiovascular disease. So it's a little bit too nuanced to get into, but ultimately, because of certain attributes of that particular fat that's in the abdominal cavity, it's not necessarily even fat that you can see from the outside. It's not, and so even a relatively small amount of that fat that's around the internal organs creates an significantly elevated risk for type 2 diabetes and heart disease, heart attacks, and even Alzheimer's disease. So it's wonderful to be able to check these types of metrics in people, again, way before symptoms ever occur, and say, hey, this is a perfect opportunity. I tell people, look, this is wonderful that we've found this, because now we have so much time to make a change.
And again, that was another thing. I was doing it for body fat composition. Visceral fat was not a part of my vernacular as well. Now it is, and now it's something that I'm thinking about because of the DEXA, and because of you, and because of Jane and all the great work you both are doing. Talk about some stories about success stories at Fountain Life that that you'd like to share with our listeners, and also for our listeners and viewers. How can they sign up for Fountain Life if they're getting inspired by listening to you, or they read Tony's book and listen to this podcast? Is it hard to sign up, and how does the process even begin?
Yeah, so thank you. I guess I'll answer that last question first.
Yeah.
So there's two ways. Going straight to the Fountain Life website. There's easy access to clicking to learn more about Fountain Life. You'll get connected to an advisor.
Okay.
And that would be the probably easiest and most streamlined way, because you go through our advisors, and we have a whole tech team that was involved in that. Maybe at some point we'll figure it. We'll talk. If people are having trouble, I guess, getting an appointment, maybe we'll have some way that people can get into contact with your team, and then they'll put them directly in touch with me.
Exactly.
But yeah, so you mentioned success stories. So,
Yeah.
I mean, at Fountain Life now, I've been here doing these, these essentially these very advanced executive physicals for more than a year, and I mean, I think I'm on my fourth totally asymptomatic diagnosis of kidney cancer. So it's a isolated tumor of the kidney that we pick up on the full body MRI, and I mean, yeah, we're down to I think our fourth person who we found it. It was early. It had not spread past the kidney. It had not, quote unquote, metastasized. And for every single person, they bring that. I say, I call them immediately. I say, you know what, we found something. This is why you came in. And I say, this is the next step is we're going to get you to see a urologist, a urology surgeon, and we're going to probably get this thing out. And sure enough, it's our fourth person who's taken this scan to the surgeon, and the surgeon says, wait a minute, why did you get this again? You have no symptoms? And the person says, nope, no symptoms. I got this scan at Fountain Life. And the surgeon says, well, and sure enough, they take the thing out and they do an analysis of it, a histological pathology analysis, and say, yeah, this was kidney cancer. And yeah, I mean, they saved your life. There's no way anybody would have picked this up until it would have spread. It spreads to the bone, it spreads to the brain, it spreads to the lung. So this would have spread somewhere and been definitely inoperable and maybe untreatable. Now it takes a while. So kidney cancer actually takes a while to spread, but it was just it's just amazing to hear these stories. And of course, our clients are incredibly grateful, but again, it's not, of course, just us. It's us creating this system whereby people can come in and get this full comprehensive health evaluation.
And how often when you get to be, I'm 60 years old, Dallas, when you're 60 years old or even 55 or 65 or whatever age people come in, you're much younger. When people start coming into Fountain Life, is it a yearly checkup that they come for you with? And is there ongoing care? Or how does the cadence of care really work?
Yeah. It's very individualized. We have some people that become members, and there's that's another set of
Okay.
details. But ultimately, I mean, some people come in and it's a one and done. That they've been very concerned about their risk, and maybe they come in and they have a few things that we talk to them about, and then they say that's amazing, and I'm really happy, and I think I'm good for now. But a lot of our clients are sort of, I think, in the mindset of, well, I found that I either found something and treated it, or thankfully found nothing on this first go round, and they actually choose to come in either yearly or every other yearly, as essentially a full health upload. That's kind of the term coined by Peter Diamandis, who's again a very futuristic thinker and tech entrepreneur. And so thinking that you're almost digitizing as much of your body as possible and having it in the cloud, the sort of tech cloud, so to speak. Being able to track and measure things from on a yearly basis. So, look, I think there can be more traditional physicians out there that would push back against that and say, wait a minute, you're getting way too much, you're doing way too much testing, you're creating anxiety in people. It doesn't have to be done yearly. And I'd say, well, hold on, I don't want this to become a political or strongly emotional kind of discussion. I've done now hundreds of these evaluations on people, and I don't even know if I can count a single person who maybe I don't know about it again. So maybe there's people who had a bad experience and I don't know about it. But I don't get, most of my clients follow up with me. Almost everyone follows up with me. And at no point has somebody said, this scan gave me so much anxiety, I'm never doing this again. No, I mean, it's about, because we will find asymptomatic things. When we do your MRI, John, we're going to find probably a cyst in the kidney, a cyst in the liver, but a benign thing here and there. The idea is not to catastrophize those things and say, "Oh,
Right.
wow, we found something." We're gonna no, we don't biopsy things unnecessarily. All this comprehensive testing is ultimately kind of designed and woven together to give reassurance, and we only really follow up on things that are that are high risk. So it's ultimately a mindset change. It's let's get the full body upload. Let's find out what your baseline is, and then just, kind of, I guess, impassionately or
Yeah,
dispassionately
yeah,
check this on a relatively ongoing basis. Some people choose a yearly cadence.
right.
The reason why, I mean, again, a year is pretty simple. You do a yearly physical,
Yeah,
and it's just every year it comes up. Now, and there is a little bit of science behind it too. So if, for example, we did your full scan and we found nothing, and this is great, okay, no tumors, no masses, nothing urgent. If the next day there was some little mass there that suddenly became detectable just the day
right,
after you got the scan, the
right.
most unfortunate, if we waited a whole year and rescanned you, theoretically, most things would still be very small in stage 1 on that next year. So a year is a pretty good opportunity to repeat a lot of scanning on people, the early cancer detection blood test as well as an MRI.
And I'll push back on like you said, on the anxiety, argument. The other argument is once you start working with Fountain Life or at Danford Works, the peace of mind you have on the other side, once you start getting these tests, is worth all the minor anxiety going in to what are these tests going to show. I'd rather
Right.
know than live in, than have everything opaque.
Right.
I mean,
Again, yeah, and look, it's people's bodies. I get it. I mean,
right,
people are anxious, and this
true,
is it. I mean, you got
true,
one life,
true.
so I get the anxiety, but if I can somehow coach people that are listening that would say, I would never want this because, and again, I'm not trying to convince anybody to get them tested.
Right.
I'm again,
No,
oh, I
no,
guess I forgot to do the caveat. Like,
yeah,
I'm not a doctor, your doctor,
right.
you know,
Say
uh,
that. I want you to
yeah,
say it.
this is not medical advice.
Right,
Any questions you have, you should see your doctor and ask your doctor about
right,
them. This is blanketly just
right.
talking about
We're having a
things in
discussion.
general.
We're having a
Um,
discussion.
but that being said, again, the philosophy of this would be like, okay, again, not thinking so, again, thinking more dispassionately about just how these things. So think about it this way. Would you want to get into a car or an airplane that doesn't undergo regular checkups, right?
Right.
No, you wouldn't. You wouldn't want to go to an airplane. It was like, well, why would you want to know? I'm going to get on the airplane anyway. It's like, no, you want to get out, you want to get that thing checked out before you take off. And if you find something, well, thankfully you found something now and you could fix it before you take off. Again, obviously there's maybe some flaws in that,
Right.
comparison, but I think
Yeah.
people get the idea. There's a way to go about this without getting wrapped up in the anxiety. And again, if people have anxiety, then that's again something that we counsel people on.
We're going to switch hats now from your great work at Fountain Life. And for people that want to find Dallas and Fountain Life and all the great work all Dallas and his colleagues are doing there, or to sign up for some of these tests and to meet Dallas in person at the Naples facility where he's the medical director, please go to www.fountainlife.com. Fountainlife.com. Now we're going to switch hats now where you're the medical director for Danford Works with your wonderful wife, Jane Danford, Dr. Jane Danford, who I've known
Yeah.
now 10 or 11 years. And she's been also my physical therapist and now working with her on other issues with you. Talk a little bit about Danford Works, why Danford Works was created, and what you and Jane do there together.
Sure. So Danford Works, it's a personalized wellness platform that combines some health data analysis and one-on-one coaching,
Okay.
and to empower people to achieve better lifelong health. So it's essentially a team of expert clinicians, and so a physician, but physical therapists, dietitians, wellness and nutrition coaches, certified strength and conditioning specialists, that essentially guide, educate, and inspire you on a wellness journey from the comfort of your own home. Um, so, their mission, of course, is just to make health optimization more manageable, enjoyable, and accessible for people. Um, So, so Jane created Danford Works. Really, she started it as a physical therapy practice based out of New York City. As you know, that's how
Where I
you
met
met
her,
Jane.
right?
And she quickly realized, though, seeing patients for almost 10 years, before starting this more comprehensive platform, she really recognized early on that in order to get people to recover as fast as possible, she really had to address their whole body health. And she started focusing on the big picture, the quote unquote big picture, pretty early on. And she noticed that her patients were recovering more quickly and looking better, feeling better, performing better. And it just took her time to gather together the right colleagues and the right partners to put together this comprehensive program. Yeah, and so it just was no surprise, because even before Jane started, this current iteration of Danford Works, back when it was just called Danford Physical Therapy,
Right.
she was her clients' go-to, essentially, health consultant. And I mean, maybe
Yeah.
you have stories, right? I mean,
Yeah.
actually, I'll let you tell it, but the reason why you even met me was because you asked her, what doctor should I see, right?
That's right. That's
Yeah,
exactly right. I was seeing one of your colleagues who was
yeah,
traveling at the time when I got injured, and he was my doctor because of
yeah,
Jane,
yep,
Dr. Kirshner,
yep,
uh, out of NYU going back then. And then you were available, and I came to see you, and you were amazing as well.
yeah.
And not only did I learn about the trapeze. But it was literally in that room, and it was. I just remember sitting in that room. I remember which side the table was on,
Yeah.
where your desk was on the right hand side, where the examination table was on the left hand side, and I said to myself, "These two should be together. Jane and
Uh,
Dallas should be
yeah.
together.
Yeah,
These two
that's
are
right.
two geniuses. They're both geniuses, and they
Yeah.
know way more than any other doctors I've ever met in
Yeah.
my life. And thank God that worked out.
Yeah.
But yeah, you're right. Jane was a great she is a great facilitator in terms of making sure that her clients were always being taken care of for their needs. And everyone she ever sent me to was amazing. So, I mean, it just
Yeah.
made sense for her to put together Danford Works. You're 100%
Yeah.
right.
So she has tons and tons of examples of amazing success stories, but this iteration of her company was really born out of so many of her clients asking her, who do I go to for this? What does this mean? Should I be taking this thing? Should I be going to this thing? Is this surgeon good? Is this?
Right.
And it was just she realized that in the world of whatever our current world of social media and where people are getting their information from, I mean, as difficult as it was to find a good physician, I don't know, 10, 20 years ago, you'd think, okay, with how, with the internet, Google, Yelp, it's going to be so much easier, right, to get good information. And how not true, how untrue is that, right?
Well, it's the par- it's it, you bring up a brilliant point. It's the paradox of the internet. The paradox of the internet is because you think then the best would rise to the top, but the truth is, so many of the frauds and charlatans have a chance to rise to the top. So you have a
Exactly.
democratization of the fake ones, the ones that really don't know how to get it done. So it creates more confusion than
Right.
before we had the internet, frankly speaking.
Right. So seeing that and constantly having her clients asking her, is this legit, is that legit, is
Right.
this treatment, should I be doing this, that,
Yeah.
she said, wait a minute, like this is an opportunity to gather together a team, a multidisciplinary team,
Right.
to coach people one-on-one from everything from injuries to body recomposition, weight loss, and way more than that. um,
And
so yeah,
the beauty of it is you and Jane get to do this, and your clients get to do this, and it doesn't matter if they're sitting in Fresno or in Paris or in New York
exactly,
or in Hawaii or in Shanghai. You can see this can be done all remotely now.
exactly.
That's
Yeah.
amazing.
Yeah.
That's
I mean, we have so many great stories. Like we had an elite runner, basically told by multiple physical therapists, multiple orthopedic surgeons, but she basically ruptured her hamstring and had surgery and was told you might really never run again. Elite runner, almost a professional runner. and she worked with the Danforth Works team, including at one point Jane, and then our other executive team member, Oren Manalo. And they assessed every angle from her kind of top to bottom, nutritional assessments, body composition, bone density, along with a very in-depth physical therapy assessment, and they got her back to running, essentially, completely against what many physical therapists and orthopedic surgeons said. You'll never get back to your prior pace and speed and competition fitness, and she's now one of the top female ultra runners in the country.
What's next for Danforth Works? What's the plans?
Well, yeah, that's a good question. That's what's next. I think I think there's going to be, in the evolution of a small startup company. I think it's going to be, slowly. I think the next thing is probably going to be figuring out how we're going to hire a few more coaches and hire potentially a few other physicians to round out our virtual platform. And then probably some upgrades to some back end technical things, make things a little bit easier for people to access data, and so mostly those kinds of things. But I think it's very open. I think that the nice thing about the platform is it's predicated on Jane's kind of prior concierge practice, where it was exceedingly high value information from one-on-one coaching from a very selective group of experts. So again, and it started with Jane's expertise, and it's just expanded. The only people she brings on. So like for example, her wellness and nutrition coach Tracy Friedman was heavily involved in this other case here I'll tell you about. We had a client who her doctor told her, you have osteoporosis, and put her on some medication and said, look, this is just to slow your decline. You're going to decline. Your bone density is going to get worse. This is just trying to help prevent a fracture. But again, she came through Danforth Works. She worked with Tracy Friedman and developed a strength program, worked with Jane, as well as this whole nutrition program, upped her protein, dialed in all of her nutrition. And at 6 months, she got another DEXA scan. And again, her endocrinologist basically couldn't believe it. They said, your bone density actually improved. And again, to some people that don't know that kind of or aren't familiar with it, it's very uncommon for bone density to improve. It's mostly, again, a lot of the treatments are meant to slow the decline. So this is, again, just another, yes, it's an anecdote, but it's a wonderful anecdote saying that we can make a huge amount of change. But again, it's a lot of one-on-one talking. It's a lot of phone conversations and video messaging and really getting into the details. What's going on in your life, and how can we help you make meaningful changes to your habits and your fitness?
Well, Dallas, as our listeners and viewers have gotten to know you, they're getting to know that you get to work with cool people like Tony Robbins and Dr. Peter Diamandis and all the colleagues you have at Fountain Life. But then, everyone's dream is you have a day job, and then your side hustle, and I always say that with love and admiration, is you get to work with your wife, who's another brilliant practitioner, and build the entrepreneurship side of your creativity and DNA, which is fascinating unto itself. So because you get to live in that, you're surrounded with all these experts and wonderfully successful practitioners. So let's talk a little bit about, we've talked about testing. Well, let's talk about practical, actionable things our listeners and viewers can use that you've seen in both your own life and Jane's life, but also in your client's life, that can be put to use when it comes to nutrition, exercise, and sleep. Why don't you share some of your thoughts on nutrition, exercise, and sleep for best practices?
Okay. That's broad. I like it though.
We'll break it down to each segment. Just general good thoughts on how should people who want to improve their health and wellness nutritionally. What's some good guidelines? Is it Dr. Greger's Dirty Dozen of things? that we should
Yeah,
be?
yeah,
I mean, like, what are your
yeah,
things that are
yeah,
truisms that are some good guidelines that people could be doing better?
yeah. I guess, okay, so for, let's see. Okay, so let's go with, so for nutrition,
Yeah,
easier actually to start with debunking some
good.
myths
Do that.
before we get to, so there's a lot of myths about nutrition and diet. Um, and these are woven into the current fads, right? Fad diets have been around, right, for a very long time.
Right.
And they just morphed subtly, and some have gotten popularity and then resurged, right? So currently we seem to be in this like, keto, paleo kind of carnivore thing right now, and as well as this intermittent fasting kind of like, when should I eat? And so what ends up happening with dietary recommendations is we, typically it's creating this essentially like some sort of like a fear mongering. Okay, that this particular macronutrient, this particular thing is bad for you, and so
Right.
we basically need to do everything else that's not that thing. Or the problem with
Yeah.
all of health and society is that people are eating too often, so we just
Right.
need to eat less often,
Yeah.
and that'll fix everything.
It's a
Or
zero sum game. Either do it our way or you're doing it wrong.
right, 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 right. And so, there's been a ton of research lately that's come out. There was a big explosion about intermittent fasting. I tried intermittent fasting, for just as an example, and it
Yeah.
was like this big thing because they thought, well, you only eat in a window, a certain time window, and that's going to upregulate certain these special chemicals in your body. They're gonna fight cancer and help you lose weight and all this stuff, as long as you're just not eating for whatever they said, 18 hours or 16 hours at a
Right.
time.
Right. Right.
And there's some huge studies that came out of both the US and China and elsewhere. So multi-center trials that show that, in general, people weren't all that much healthier at all. Really no statistically significant changes in many metrics of health for almost a year of intermittent fasting. Some of the studies were less than a year. So what it truly came down to was the following. No matter how you did it, if you ate less calories, if you were started off overweight and had metabolic issues, either pre-diabetes or
Right.
high
Right.
cholesterol or whatever it was, no matter how you did it, if you ended up eating less calories, you were healthier. It didn't matter exactly how you got it. Now,
Right.
okay, so that's sort of an example of how you can take this new fad and then actually have to kind of break some of it down and wait for some new research to come out. Um, it's funny that the single diet that tends to have the most amount of evidence behind it, it's pretty, I mean, it's pretty boring for me to say it. It's the Mediterranean diet.
Yeah.
Over and over again, it's the sort of try to eat mostly, it's the kind of Michael Pollan thing, like try to eat mostly plants and eat, just enough to satiate yourself. Whether or not you throw in some lean animal protein or you get most of it from plant protein, seems like it doesn't matter all that much as long as you're getting enough protein.
Got it.
But the Mediterranean style diet where it's relatively low in saturated fat, um, with lots of a variety of fresh fruits and vegetables, and then the beans, legumes, nuts, etc.
Right.
That, like, again, over and over again, it's been shown to improve brain health, and blood vessel health, so reduce cardiovascular events. But over and over again, it tends to be, if you are at risk, the main thing is to find out. Oh, and so here's the other thing: is that diets are different for everybody.
Right.
So whatever diet tends to help people be the most satiated and tend to overeat less tends to be the best for their metabolic health. So if they can
Got it.
get their intermittent fasting, great. If they can get there, on a high carb vegan diet, great. But so I guess what I'd follow that up with is, we won't really know until we get a sense of your metabolic health. So
Right.
unless you get your blood work done regularly, you get your body composition done, and we know how much visceral fat you have. We know, those are the kinds of things that we want to. I'd recommend people be checking to make sure their diet is right for them.
That's so great. How about exercise? Obviously, you and Jane are extraordinarily fit. You're built like an athlete. Jane's an athlete. What do you think people can do in terms of fitness, actionable? That's they don't have to go out and buy a Peloton bike right away and other things to prove that they're going to really get there. What can people do to be more fit in terms of activity?
Yeah. So and again, I hate to answer this question again with a hey, we have to do more testing kind of answer.
Right.
But what I find, there's a lot of situations where if you're starting off with, I love playing X sport.
Right.
Should I not play that sport for some reason? And I generally say, look, if you can find something that you love doing, that's primacy. That's number one. If anything's going to get you up off the couch and to do that thing, amazing. And that's what I say, like that's got to be number one.
Right.
So after that, after you kind of, okay, so you have a huge hobby that you love, great. We'll use that. That's number one. But based on the data, if we're talking about just the maximizing health span and lifespan, so let's take cardiovascular fitness. There's a measurement of cardiovascular fitness called VO2 max. That's essentially how good your lungs are at extracting oxygen out of the air. Maybe as I explained that slightly poorly, but that's the idea. So it's how good your lungs are extracting oxygen is essentially almost a linear curve for lifespan or inversely correlated with mortality.
Okay.
So some type of cardiovascular training, again, if you hate cardio and you'll never do strict cardio, but you'll get out on the tennis court, well, amazing. I mean, that's great. That's what you got to do.
Got it.
But all things being considered, some type of cardiovascular training 3 to 4 times a week, that's activating that system that will, again, help you increase your what we call cardiovascular fitness. There's no question that that's correlated with longevity. Now, that is one. The other is resistance training. So some people, you can't get them out of the gym and they just love weightlifting. And then there's other people who can't stand it and never want to step foot in a gym. Again, it depends. In people who are relatively, I guess, under muscled or have too little muscle mass, again, and we can define that. There's a term in medicine called sarcopenia, and again, we can determine that by testing. And if people are on the lower end of muscle mass, it would be tough for me as a kind of health consultant to say that, oh, you're okay with that low muscle mass. That's not. No, I mean, if I see somebody in let's say the 10th percentile for their age and muscle mass, I gotta say, we gotta hit the gym a little bit. We gotta find some way to get some resistance training to put muscle on you. Now, in a world of, as you said, Pelotons and group fitness classes, as well as swimming, running, yoga, Pilates, and all of these other kind of fitness crazes. I look at some things and say, look, so I will typically, here's an example. I'll give you it's much easier as opposed to giving blanket advice. Here's the specific example. I tend to see, let's say I see a woman who's in her, let's say mid 50s, incredibly fit, super low body fat, and we find that her bone density is a little on the low side, and she is very fit and thin and petite, but actually has on the low, like maybe in the 15th or 10th percentile of her age in terms of muscle. That kind of stereotypical kind of archetype is also the type of person, at least in the United States, who tends to focus on Peloton and Pilates. It's the super high cardio, and and I said, do you do any strength training? And they say, yeah, I do lots of Pilates or like a ballet bar class or something like that. Right. And maybe that shows my like New York kind of like bias, but whatever, or LA too. So right. But here's the problem. I say, look, you can do Pilates all day long and ballet bar all day long, but 100, like leg lifts and hip thrusters against no resistance, you're not going to gain muscle. And if we take your body composition now, here's the raw data. Maybe at 55, you look great, you fit into your dresses and whatever. But at 65, 75, 85, the ability to maintain that muscle goes down and down and down. So if you're in the 10th percentile now, it's going to be the lower and lower and lower. And it's so the 10th percentile when you're 55 is starting to look like what we call sarcopenia by the time you're in your 70s or 80s. Your risk, once you hit sarcopenia, your risk for dementia, cancer, and falls and head injuries and hip fractures are all elevated at that point. So I have to say, look, at this point, you're in the top shape of your life, but we have to think about putting muscle mass on you. So that's I hope that was helpful for exercise.
Very helpful. Talk a little bit about sleep. What's your thoughts on sleep? More is better, and this sleep when I'm dead mantra when I was in my 20s is also now dead and behind us.
Yeah. Yeah, I could have said we could have tackled sleep first, honestly, because of the pillars of health. I mean, there's nothing that makes it more difficult to stick to a good diet, a healthy diet than getting adequate sleep. I don't know about you, but I've never had the worst dietary choices than being sleep deprived at the airport. Right, it's the worst.
Right.
And
or
similarly,
even an exercise program that I could stick to if I'm sleep deprived.
Right.
Yeah.
So that's kind of the obvious one, but I'm gonna almost plagiarize essentially from a lot of my mentors and my reading on the topic, because the importance of sleep is like woefully undertrained in medical school. Not to mention by how poorly underslept of medical students and residents are personally, but the training is terrible in it. But I mean, the statistics just go on and on and on. I mean, the risk of cardiovascular disease, the risk of cancer, the risk of dementia, all go up in populations of people that are sleep deprived. Scarily enough, I think the World Health Organization actually classified night shift work as a carcinogen.
Wow.
Yeah. So people that engaged in night shift work had such a higher increased risk of cancer that the World Health Organization reclassified it. Yeah, it was pretty amazing. So so how to sleep better? There have been books and entire podcast audio series devoted to getting better sleep and the importance of sleep. I typically have my clients say, look, if you're having poor sleep, let's break some things down. One, is it some kind of a medical problem that needs an accurate diagnosis? For example, right? Like if somebody has obstructive sleep apnea, where they're just suddenly waking up, maybe they notice it, maybe they don't, maybe they're snoring so much their partner knows it, whatever the thing is, if that's a medical thing, it doesn't matter how much melatonin or setting the temperature down or whatever sleep ring you're wearing is not going to help somebody with a medical issue, right? So see, as I said through the whole podcast, I can't be your doctor. But and so don't take this as medical advice, but for sure, if you're having a significant type of insomnia, you should get an evaluation from someone that's qualified. So cutting out the actual medical reasons why you might not be sleeping well, now you want to classify insomnia. So there's ultimately three types. I may be not getting this perfect, but the idea is that there's I'm having trouble getting to sleep, the sleep onset. Then there's I'm waking up in the middle of the night. So it's the sleep maintenance. I can't maintain I got to sleep perfectly fine. My head hits the pillow, I'm asleep. But then at 2 a.m., boom, I'm up. That's the sleep maintenance insomnia. And then there's a whole other type of insomnia where it seems like you get to sleep okay, and maybe you're not waking up too much, but I wake up every night, every morning, and I just don't feel well rested. So once you get categorized properly, and of course rule out serious medical issues affecting your sleep, then there's a whole algorithm for trying to help people figure out what those issues are. And so I mean, at this point, it's almost like so many of the people I talk to, even people that aren't super into health, have heard of all the sleep hygiene recommendations, the not eating 3 hours before sleep and not over exercising 3 hours before sleep, shutting off your screens an hour before getting to sleep. All of those things are very, very helpful. But
Sugar is a no-no. Alcohol is a
yeah,
no-no.
alcohol, of course, sure. So I would point people toward definitely my favorite book on the topic. It's called Why We Sleep by Matthew Walker. John, are you
Yeah,
familiar with John?
That's really become
The go-to.
the Genesis book on this whole issue.
Yeah.
The compendium of information.
But but I'd say that if those basic guidelines in those kinds of books, and Matthew Walker also has a great podcast where he kind of breaks down a lot of his recommendations. If people are finding that they're just not getting, so that's like the basics, right? The sleep hygiene stuff. At some point, it is very helpful to then say, okay, I should get a health coach and get a physician who knows what they're doing and delve into my individual issues, because that addressing each one of those things, it's very individualized. So but I found, I mean, there are a couple of the sleep, I guess some very practical things, again, that's been mentioned, but I can just take some of my my experiences as something to jump off of. So for example, if you hear the whole, okay, you have to sleep at a lower temperature, in ambient temperature, it's a great recommendation. And Matt Walker talks on and on about the data where they measure people's body temperature and they drop it down and they show sleep, they start to get to sleep better when the body temperature drops and all these things. Well, that's great. And they can actually specifically have these people wear full body suits of cooling tubes and they can cool down different parts of the body. Okay. But here's the problem. In the real world, and he also acknowledges this too, but in the real world, you have to, again, I have to sleep next to my wife who likes an ambient temperature much higher than mine. So, the practical solution there is something like, for example, a sleep mattress or a cooling mattress or a cooling topper that has two different settings, right? So I cool my side of the bed down way lower than hers. And it allows for that sort of me optimizing my temperature and she gets to optimize her temperature, and there you go. So that's an example of a little bit of a hack that, again, so we leave the thermostat higher than I would want it, but I get to cool my side of the bed better. So that's kind of an example of how you have to, merge the science with practicality.
But Dallas, we've covered a lot today. I want to give you any final thoughts before we say goodbye just for today, because we're going to have you back on, because I know you and Jane are going to grow Danford Works. I know Fountain Life is going to explode in the years to come, and that practice is also going to grow for you. Any final thoughts on health, wellness, and longevity before we sign off for this episode?
You know what? We've covered so much. I think the one thing I would say is, I mean, the big overarching theme of this is that, like, you can't manage what you don't measure. So
I love it.
So the proper testing, getting to know what you want, focus, and then that will help you focus on your goals. And then find an expert to work one-on-one with. It as you mentioned, again, in the world that we're living in, with almost so much information, where unfortunately almost like the worst information rises to the top. The social media algorithms are not designed to raise to the top the most accurate information. It's the information that gets the most likes or comments or paid promotion. So finding the right expert and working one-on-one with that expert would be my recommendation.
If what rose to the top was all that we saw was the best, we'd be visiting Dr. Kim Kardashian, I guess. But anyway, Dallas, thanks again. Again, for our listeners out there, this book is one great example. Dallas is actually talked about in this book, and this is a great book, and his practice at Fountain Life is amazing. Please go to www.fountainlife.com to find Dallas and his colleagues and all the important work that they're doing there. To find Dallas and Jane and all the great work they're doing at Danford Works, please go to www.danfordworks.com. DanfordWorks.com. Dallas Kingsbury, you're making a great impact on people's life, longevity, health, and wellness. Thank you for joining on this episode. We're going to have you back one day to talk about the continued journey that you're on at both these great institutions. And thanks for spending time with us today.
You got it, John. Thank you.
This episode of the Impact Podcast is brought to you by Closed Loop Partners. Closed Loop Partners is a leading circular economy investor in the United States with an extensive network of Fortune 500 corporate investors, family offices, institutional investors, industry experts, and impact partners. Closed Loop's platform spans the arc of capital from venture capital to private equity, bridging gaps and fostering synergies to scale the circular economy. To find Closed Loop Partners, please go to www.closedlooppartners.com. This edition of the Impact Podcast is brought to you by ERI. ERI has a mission to protect people, the planet, and your privacy, and is the largest fully integrated IT and electronics asset disposition provider and cybersecurity-focused hardware destruction company in the United States, and maybe even the world. For more information on how ERI can help your business properly dispose of outdated electronic hardware devices, please visit eridirect.com.